Ministers, as I have published a report entitled Every Child Counts. I don't know if you got a chance to see it. It's just actually been sent to me yesterday. But it's the results of the survey carried out by them, which they are keen to indicate is just a snapshot of autism services and supports. They surveyed parents of children with autism, and the key findings were that 2/3 of parents and guardians surveyed have had to wait 2 years or more to receive an autism diagnosis for their child. Over 50% felt very dissatisfied with the HSE support services for their autistic children, and almost 4 in 5 said that they were not in receipt of any support from either the early intervention or school age-going teams. Now, this survey was carried out and is based in the last 15 months, so it incorporates the COVID period. And I think the results are alarming, and I think it's very important that now that this Dáil looks at something that's been discussed on many times before, an autism strategy being progressed and an autism committee being established. It's extremely important, as the numbers of children with autism seem to be increasing all the time, and the supports are not there to deal with it. Also in the report, respite was mentioned, and respite provision has been very poor. It was even poor prior to COVID and non-existent during COVID. Respite provision needs to resume, and it needs to be provided in every county, and it needs to be provided for children and adults separately but simultaneously. There was €5 million provided in the budget to open 9 additional respite houses over the course of the year. Now, I know one was opened in Limerick, and that is welcome. I'm not sure what state the others are at, and I'm just wondering, will they be opened within this year? It's absolutely essential that they are. Also, in relation to respite, there needs to be separate emergency provision which will not interrupt the pre-booked respite provision being made available to families. Many families tell me that they have their child booked into respite, have booked a couple of nights away. Next thing, they get a phone call the following day to come and take their child out of respite, and their break is interrupted. That can't be allowed to happen. That's not fair on families. Also, respite needs to be person-centred, and it needs to be provided and designed with the interest of the child or the individual at heart. Children, as you've mentioned, have missed out on a lot of school contact time between last year and this year, and children with additional needs have been impacted more greatly than others, and we've seen much regression in many cases. And I do welcome all programmes that you indicated that were offered, Minister, and the enhanced summer provision programme that has been set in place is very welcome. However, parents have been telling me that there's some difficulty in provision in some schools, and that they're very disappointed that perhaps their local school isn't providing the service because of insufficient staff. And I'm just wondering, has this been dealt with? If the staff in the school are not willing to provide the service, can staff from another school do so, or can graduate staff be incorporated or brought in to provide the service? I'm also going to deal with set allocation. I mean, the set allocation hasn't been reviewed for the last couple of years because of COVID. And while this doesn't affect some schools, and in fact may benefit others, new schools or progressing schools are missing out in light of this. And I think they are appealing it, and I'm asking you, Minister, to look at those appeals and to ensure that extra provision is put in place in those schools prior to the autumn resumption of school. Day services for people with disabilities and day services for people with dementia were interrupted terribly last year. I did welcome the fact before that day services for people with disabilities did reopen in September and stayed open during subsequent lockdowns, obviously not at full capacity, but I'm hoping again that they will resume to full capacity very soon in light of the fact that most people now will have been vaccinated, both the service users and the staff, and I'm hoping that's happening. But dementia sufferers haven't been able to access their services, and I think that's extremely important that they are reopened again if staff are fully vaccinated, and again I presume most of the older cohort of our population are, so it should be safe to do so. Also, the disability capacity review and Indicon report on the cost of disability reports have not yet been published, and I think they are imperative if we're going to plan and know where and how to fund disability services going forward. So I'm just asking, when will those reports be published? Will they be published in time for the budget preparation? There has been a call by the Oireachtas group of disability group and the IWA for that to happen, and it is imperative. There is a data deficit on disability services that needs to be addressed.
Thank you, Deputy.